Dr. D strives to deliver great care. But the way we approach medicine these days often gets in our way, especially when it comes to her older patients. Patients like Mrs. B, a widow who at the age of 77 presents with 21 active health problems, 11 different medications, 9 other treatments, 8 specialists, and 1 pooch with problems of her own, who has become the most important thing in Mrs. B's life. When it comes to Mrs. B, a lot of smart but often contradictory medical opinions get voiced. And sometimes the most important voice of all can get lost. That of the patient herself. Treating any one of these health problems has the potential to make another worse. Addressing them all is a heavy load, filled with potential harm and conflicting recommendations. And the best treatment for Mrs. B is uncertain, partly because people like Mrs. B are usually not included in clinical trials. And even when they are, the trials often don't address the outcomes that matter most to the patient. Mrs. B drags herself to clinician after clinician. Each of her problems seems to complicate another.
Somehow, I end up feeling worse and worse. There has to be a better way. I think there is a better way.
Dr. D knows that Mrs. B specialists are highly trained experts. But when it comes to what matters most to her, Mrs. B is the expert. So Dr. D's office has adopted a new approach that taps into that expertise: Patient Priorities Care, or PPC. Several of her staff, her nurse and medical assistant among others, have taken online training in PPC. The PPC process involves helping patients identify their health priorities, the health outcome goals they most want to achieve, and the care they are willing and able to do. And that helps clinicians align their care with these priorities.
I want to go out with my dog and see my neighbors. I like talking to people. And I can't get out if I'm dizzy and tired all the time.
Mrs. B's health priorities are recorded in her electronic health record, which puts everyone on the same page. Her clinicians are now able to negotiate collaboratively with a focus on Mrs. B's desired activities instead of simply her symptoms, and on her healthcare priorities rather than just managing her individual diseases. For example, Dr. D thinks several of her medications and conditions could be causing Mrs. B's dizziness. She considers stopping some medications or adjusting doses of others. Her cardiologist, however, is concerned about changing any of Mrs. B's cardiac medicines. They brainstorm, knowing there isn't a perfect answer, and agree to a series of trial changes in her medications. Through ongoing monitoring of Mrs. B's ability to do her desired activities, Dr. D is able to reduce some medications and eliminate others entirely. They agree to add physical therapy, which Mrs. B is willing to do to improve her balance and walking.
I've been able to walk my dog a bit more and even chat with my neighbors. We are going to watch closely to see if you're able to do the things you want and are less overwhelmed by all your health care. Thank you. It really helps being part of the team. Thank you for helping me to provide the best health care possible.
To learn more about the Patient Priorities Care approach and to access resources for your practice, visit patientprioritiescare.org.